Alex Adams back in Idaho from DC. How are you, sir?
Great to be back.
Yeah. Thank you for making time. I know it's the holiday break, and you carved out a little bit of time to come on and talk. Listen, I went back to DC for the first time last week, and it was total eye opener. I had never been there, obviously, hence the first time. Got to see memorials and stuff. But what I was really struck by is that there's so much. And you offered me a couple times to come by, and I was running around. So again, thank you for even offering time then. But I was really struck by, okay, there's so much going on here. And what the average citizen sees, what I've always seen is like, that's the tiniest of tiny fractions of what's actually happening. The international relationships, the nuances with policies going on, the considerations. Try this one on for size. You ready for this? So I had Sam Parrott, who's with Snake River Sugar Beet Association.
Hey, Sam.
Sam's great, right? Big fan of Sam. And we go out and we do this conversation about sugar beets during the harvest. It was like 2 months ago. It's awesome. We're sitting in an irrigation ditch. The tractors are going behind us. Great conversation. Well, it turns out that there are problems with sugar beets, especially this year, in that the harvest was so substantial that now we've like flooded the market with sugar. And to try to engage in better practices, there are international trade laws and things of that nature. So Sam tells me that things are a little dicey, and we have other sugar producers, throughout the world. Turns out, I find out when I'm in DC, that there was a snafu with Canada over sugar. Canada was sending molasses to the United States, but they were enriching it with a higher sugar content. And once it crossed over into America, into the United States, they were refining out the excess sugar and then delivering that. So they were like trafficking sugar through this molasses. And somebody put the kibosh on it, and I found out about it. And I was like chatting with somebody about it. It's like, this is insane that you would have to know that like Amalgamated Sugar has this problem with Canadian sugar producers, and that Canada is engaging in this practice. But again, those are things that you would never know, but are really, really important to people here. And again, they don't make headlines at all.
There's a hum to the city for sure.
Yeah. Talk to me about what we don't understand about what you're doing in DC.
Well, this is my third time on your show, and maybe just to recap, the last time I was on here, I was running the State Department of Health and Welfare for Idaho, and was laser focused on child welfare. In the meantime, I was nominated and then confirmed by the Senate and sworn in to be the Assistant Secretary of the U.S. Department of Health and Human Services. I'm the and Human Services side of the House. So we run about 60 programs totaling about $70 billion. It's Head Start, it's Child Care Block Grant, it's TANF, it's Social Services Block Grant, and then all the funding for child welfare, specifically foster care, adoption, guardianship assistance, and programs like that. So it's an extension of what I was doing here in Idaho, but for the nation.
Talk to me about the Head Start program, because this is, and again, I don't know a lot about these programs. What I do know, and what I've started to get very interested in is, as a younger person, I remember hearing arguments where it's like, hey, man, the government should stay out of people's business. And it's like, yeah, man, that sounds fine. And then like, hey, why are we funding, stuff for younger people? Like, and it seemed that the emphasis and support was getting younger and younger and younger. And I remember somebody saying like, we're going to have all these like government babies running around, like all these government supported kids. And it's like, okay, whatever. Like, I don't know anything about it. In recent years and times, I've started understanding there are problems, long-term problems that need to be addressed. For instance, early literacy. If you don't have a kid reading fluently by the third grade, you run into this barrier where you're supposed to transition from learning to read to reading to learn, right? So you can start educating yourself. You take off. And without that tool of being able to educate yourself and understand your world in a better way, you end up with a really high probability of being incarcerated later in life, because you fail to collect the skill sets requisite to offering the world something. Now, it's not that it can't happen, right? Like I have family members that were gainfully employed, had their own businesses, and were not very literate at all. And again, no problem, like good people, but it's very hard, right? It's much harder. So your probability of ending up with it as kind of like a ward of the state, and from at least an incarceration standpoint, is really substantial. So it was like, oh, okay, so if we spend the $10,000 to help the kid help better early reading, then we avoid the $60,000 a year later or more, right? That kind of befalls people from, being incarcerated, and we lose out on all of the benefits of their contribution. So this one investment over here really leads to like 10, 20, 40x over here. It's just that people don't necessarily tie those things together. The Head Start program is one that I've always been curious about. It's like, what's the relationship with early support mechanisms that we know without these support mechanisms, you likely will fall into one of these other categories. So it's this ROI that I don't really understand.
Yeah. So Head Start, as you said, the first 5 years are probably the most important development years because it's the foundation for the future of any child. Their capacity to learn, their capacity to read, their capacity to socialize and have positive, productive relationships really starts in those earliest years. So Head Start is one of the programs that the federal government has that really builds on that foundation. One of the things, transitioning from the state level to the federal level that I've really had to get up to speed on in short order is very few of the federal programs are we the direct service provider on. At the state level, we were the direct service provider. People came to us for child care subsidy. People came to us for Medicaid, for TANF, or SNAP. We directly provided child welfare services. We had a hotline where we responded to calls. We went out and did assessments. At the federal level, our role is more of a financier and overseer. We provide grants to 1,600 Head Start providers across the country. We provide grants to states to run their child welfare systems. I'm no longer the direct service provider. I'm the financier and overseer. So as I approach a program like Head Start or any of the other programs in my portfolio, I have two defaults. First default is I generally trust states. I trust states to make the right decisions. And I want to empower them and let them make the best decisions for their local communities. Second default is I trust parents. I trust parents to make the best decisions for their children. And in consideration of those defaults, I look through each of my programs and ask why. Why do we have to set one-size-fits-all parameters? Should we defer more of these decision points to the end users, namely parents and states who are often overseeing these programs?
When you encounter people that are skeptical about the utilization of taxpayer funds and you start talking about these types of programs, and you're saying, look, we are the overseer, what do you know that people should know to have confidence? It's like, no, listen, this money is not going to like some Mickey Mouse parade. Like this is really going to valuable things that we collectively as Americans should get behind.
Yeah, so each of these programs has evaluations, and we have reports that we put out on each of these. We have measures that we track on each of these, but certainly there's always opportunities to do each of these programs better. We've said a lot. We want to make Head Start better and brighter, and I do think that involves more of a role for the parents of the children that are in these. I mean, we have about 750,000 kids in Head Start. And I think collectively tapping into the preferences of the parents and allowing some local customization probably can make the program better and brighter.
Listen, you're going to have to forgive me for my ignorance. What exactly does the Head Start program do? Like you guys fund it, right? States execute on it. What is it? Is it nutritional assistance? Is it, like daycare assistance? Is it, parental? What is the assistance?
Yeah. So Head Start is actually one of the things in our portfolio that does not go through states. We have a network of about 1,600 providers.
Gotcha.
We can go tour one here in this area if you'd like. We've got one in Meridian. It's a wraparound support program. There's early childhood education components of it where kids come and have high quality faculty where they help teach them to read and sure. Some of the early learning basic building blocks. But there's also wraparound support for the family. It's trying to help the family on pathways to success. There might be some work supports. There's volunteering opportunities for the family because in the early childhood component, many of them offer food nutrition programs. Sure. There's healthy development there. They bring in healthcare services for the children. But there's early Head Start, there's traditional Head Start, but it's wraparound services to kids from 0 to 5 between those two programs, as well as supports for the families.
And when you talk about supports for families for like jobs and stuff, obviously the inherent issue when you're dealing with this is like, look, this family is not thriving for whatever reason. And it could be employment based. It could be, catastrophic health. It could be a number of things that essentially just this family is caring for this child and they are otherwise incapable of engaging in this moment in the requisite care for this kid. That's the idea, right?
There's a body literature that suggests Head Start. When kids are involved in Head Start and the family commits to it, there is much less entry into the child welfare system. So, I mean, I think it's like a 93% reduction into the child welfare system. So wrapping around these families, providing services, helping these kids get a head start in life, reduces entry into the child welfare system, which is where I'm trying to spend my disproportionate time and energy at the federal level.
I knew there was this nugget in your head somewhere, because every time I've spoken with you, it's like, hey, if we spend a little bit more money here, for instance, our last conversation, we were talking about helping families avoid foster care, right? And there's this cost to that, right? There's this cost with, perhaps parental coaching and assistance. There's this cost to, whatever it might be. But you're like, look, if we can keep a kid with a family, it's like $3 a day, right? And we make this investment in the community and this family. If the kid has to go into foster care, it jumps up to like $50 per day. And if they have to go into
congregate care,
there it is. I knew it was a C. Congregate care, it can be anywhere between $500 and $1,300 a day. He's like, so if you can stay with the $3 to $5 option to help the family stay together, that is the best fiscal decision we can make, aside from the whole emotional turmoil of being separated, having a family separated. And that to me, it was like, oh my God, do whatever you have to do. Like, that sounds great. And this is the one. I knew you had something in here. So the idea is that, look, if we invest this money into Head Start, right? Like, you take a body of 100 people that are at risk of entering the child welfare system, right? Collectively as families, you take 100 of these families. And if you can engage them in the Head Start program, whatever that cost is, you have 93 of those families will never have to engage the child welfare system, which means you end up saving in this mass ROI later on. You just have to make the initial investment in the Head Start program. Is that accurate?
That's what studies show. And let's, last time we talked, I think it was in the middle of the legislative session here in Idaho. And we were on the brink of making this case to the legislature. And just to tell how the story ends, the legislature did make record investments in our child welfare system in Idaho, putting more supports on the front end. We increased our team that provides prevention services from 14 people to 50 people. So it made a pretty substantial increase. That prevention team broker services, they deliver services, and I'm proud to say it's working. We've talked multiple times about the ratio of foster homes to foster kids in Idaho. And when I started, we had 74 homes for every 100 kids coming in. When he didn't have enough homes, that meant we were relying on non-traditional settings, Airbnbs, short-term rentals, hotels, office spaces in some instances. When we committed to prevention, when we committed to reducing some of the burdens, getting licensed as a foster family, when I left the state, we had 104 families for every 100 kids coming in. We stabilized our budget. We actually gave money back at the end of the fiscal year. Idaho's fiscal year ends on June 30th. We gave something like $500,000 or $1 million back, where in previous years we were begging for bailouts at the end of each fiscal year. So we proved that it worked, and we proved that it worked, and we're going to do a lot at the federal level to try to bring some of that Idaho thinking to the challenges that we're seeing federally.
Man, it is hard to shake a stick at that. One thing that people brought up in the wake of your conversations is that there was concern that some of the restrictions or requirements that got eliminated would lead to bad outcomes. Was there any issue with that? Or was it essentially whatever the red tape was that you eliminated? It's like, look, functionally, this hasn't played out in the way people people had this red tape here because they were trying to avoid a certain outcome. But when we eliminated that red tape, that outcome did not come to pass. Has there been any backward slide?
Not that I'm aware of. I mean, I've been out of the state for a couple months, so unless something has dramatically changed since I've been gone, I'm not aware of any issues that have materialized. There's a couple things I would highlight. With any policy decision, you have to say compared to what. Anytime you're suggesting to change something, there's going to be a scold on the other side of it saying, that's going to reduce quality. Not everyone has the quality that I bring to the table. You need more people like me, not less like them. The compared to what wasn't working. If you think 74 kids or 74 homes for 100 kids was working, if you think having kids in Airbnbs and short-term rentals was working, if you think having to go to the legislature each year for a logarithmic growth in our budget for child welfare was working, you are living under a rock. So the compared to what was an untenable situation. We had to look at what are the things and what are the levers that we could pull. And yes, it was a high octane offense. Yes, there were scolds. Yes, there was clutching of pearls, but it worked. It objectively worked. And what a lot of people confuse is the difference between a licensed home and a placement. I want as many placement opportunities as possible, and then I'm going to customize the placement based on the individual needs of the child. Some of the more controversial things we did was we allowed fast-track licensing for folks from other states. If you moved here from California, I think I'm sitting with one of those, and you were licensed in California, I made the value judgment that maybe we don't need to act like they've never parented before. Maybe we don't need to act like they've never fostered before. Maybe we don't need to make them start at scratch and go through 30 hours of introductory training again. But we created a pathway to quickly get new foster homes licensed, and then we customized the placement based on the skills of the foster parent and the needs of the foster child. And objectively, that worked.
Every time I speak with you, there's a clarity and a drive towards, like, look, you remember that like Wall Street scene, Gordon Gekko? It's like greed is good, and it's like that classic crazy Wall Street investor scene. But you came from a budget and a fiscal standpoint and came into, and again, correct me if I'm wrong, but you came into, health and welfare from like, okay, look, we are exponentially growing this budget. There's this huge problem. And you started picking things apart. At least the story goes that as I understand it, you started picking things apart. It's like, okay, where is the money going, right? Why is the money going here? And what are the roadblocks to avoiding that? Like conjugate care, or that's correct. Yeah.
Congregate.
Okay. Congregate. Yes. Never that word. So you have this problem of like, okay, this is one of the biggest ticket items. How do we avoid this? And it's like, well, having somebody in a foster home costs significantly less. Okay, how do we get more of that? Well, the problem is like, we don't have enough. Then once you get more, it's like, okay, what's better than foster homes, right? Not congregate care, but foster homes. Well, the cheaper thing is to actually just keep people with their families. Okay, it's cheaper and it's better for everybody. As long as, like you keep them with their families and not in a bad situation, not from a neglectful standpoint, but from okay, look, we can make this family objectively successful at staying together. Okay, great. How much does that cost? $3? Okay, let's take the $3 option, right? And you keep coming at it, at least it appears, from this real fiscal position where it's, hey, do we have the good fortune of having the fiscally responsible decision also being a better decision? And it appears that at least in a lot of the work that you're doing, it's like, yeah, that's the benefit we get. That if you look at it long enough and you understand the levers well enough, you can start saving money and having better outcomes for everyone. Is that?
This is one of the few areas where as a former budget director, I can say unequivocally the best budget outcomes and the best child welfare outcomes are perfectly aligned. Prevention, lower cost, better return to the child. Placement in a foster home, primarily with a relative, best outcomes, lower cost than with non-relatives. And then congregate care is your most expensive and your worst outcome setting. So boiling it down from a budget standpoint as well as a child welfare outcome, you're going to get to the same outcome. I think one of the challenges we had is, we were in crisis when I started in Idaho. We had legislative oversight report after legislative oversight report. We had a whole group of stakeholders that had different ideas. The challenge is there wasn't focus, and we had to boil it down to focus. We talked about, how I've used the 4 disciplines of execution, said, what is the main thing? And then put all your energy and all of your weight behind that main thing, and don't get into a situation where you're just firefighting and careening from priority to priority. And we said, what we're going to do is we're going to focus on getting our ratio of foster homes relative to foster kids up. That gave us 2 areas you could target. You could recruit more foster homes, retain more foster homes, pivot to kin, do things to get your numerator up. You could also do things to get your numerator down. You could prevent kids from coming in to begin with. You can find them permanent homes faster to get them either adopted or reunified faster. You can give them legal advocates to help them navigate that and get out of the system faster. So you can do things to get your numerator up or your denominator down. And that's how we had success. The other thing that we did in Idaho was then we measured that weekly. We would look at a team at that number as a team each week and say, are we making progress? How's our numerator? How's our denominator? If we weren't, let's do something different. If we were, let's double down, let's triple down. We got in a cycle, rapid cycle innovation, and made a big difference in a short period of time because we weren't afraid of an action imperative. We weren't afraid to workshop everything to death. And, too many states will want to do focus groups and studies where these kids are literally driving by the time the study is done. We did some things that worked. We did some things that didn't work, but we got in a cycle of rapid cycle innovation, found what worked. A lot of what we're going to do at DC, what I'm going to try to do at DC, is bring that type of thinking to the agency that I now oversee. You might have seen about 2 weeks back, President Trump and First Lady Melania Trump jointly signed an executive order called Fostering the Future. It's a bold, transformative leadership initiative to try to improve the child welfare system in the United States. It had a number of parts that are entrusted to me, and I'm going to push as hard as I can, as quickly as I can to deliver on what President Trump and First Lady have asked us to do.
Do you think that is there enough autonomy within your department and within your specific area to engage in those things? Because you hear these horror stories of oversight, of paralysis, essentially, not just coming from the department with somebody who really wants to be sure it's the right answer, but from people that are essentially blocking progress because again, and look, I don't know anything about national stuff. But I do know that there really are problems where you don't want progress for the sake of, say, midterm elections. You don't want people to get wins because you want to capture that time frame leading up and exact as much pain or have difficult things to point to. Be like, see, this didn't get fixed. It's like, well, it would have gotten fixed if you would it's like the astronauts, like Musk saving the people floating around in space. It's like he could have sent up a ship at any point and grabbed those people and they could have come back and it would have been fine. Or, I remember with the pandemic, there was a articulation about the therapy that eventually came out before the election versus after the election. You have the exact same people saying completely different things. Are you worried or concerned about that in your position?
I would characterize myself as optimistic. I mean, this is an area where there's historically been bipartisan support for child welfare. If you look at recent legislation that was monumental in the space, Family First Prevention Services Act is a good example. It passed with broad bipartisan support. Just this past December, January, the Title 4B reauthorization, which is one of the seminal pieces of child welfare law, it was reauthorized with broad bipartisan support. So I'm optimistic that this is an issue that speaks to both sides. And I think the top-level attention from President Trump and specifically the tireless advocacy from the First Lady and signing of an executive order directing us to make certain changes, I think provides top-level leadership that will allow us to move forward. A lot of what the executive order does is direct agencies to do certain things within 180 days. So I'm going to move fast. Our primary thing that we announced in conjunction with it, so I would view the Fostering the Future executive order that the President and First Lady signed as a whole of government approach. And then individual agencies, mine included, will have things within it that we are trusted to move forward with to make a difference for these kids. We announced our initiative is going to be called A Home for Every Child. Building off of what we did in Idaho, we're going to start looking at each state's ratio of homes per children and structuring our incentives around getting the numerators up and the denominators down. We're going to look at policy reforms that will get the numerator up and the denominator down. I told you when I started in Idaho, my ratio is 74 homes per 100 kids. Nationally, the best data we have is that there's 57 homes per 100 kids. And I'll put some caveats around that. Even though we require 200 data points reported to our federal agency from each state, the number of foster homes is not one of them. So we backed into the 57 homes per 100 kids by taking some data self-reported from states to a private entity, divided by the number of foster kids reported to us as close as possible to that date. So it's an area where we didn't prioritize nationally to the extent we didn't think the number of foster homes was in the top 200 data points that states wanted to report to us. So we're going to be changing some of that post-haste.
That's wild. If I may ask, I don't mean to out any states. Which states appear to have the worst ratios?
Until we put out the report, I'll probably withhold judgment. The challenge in citing specific states is because the data that we're drawing from is self-reported to a third-party news outlet. So some states that look high, some states that look low, it might be not apples-to-apples comparisons. It is the data that we could make the closest judgment from. What we're going to do is, since we spend about $12 billion on child welfare each year, you can guess that we'll probably start asking states to report that ratio with fidelity so that you can make more appropriate apples-to-apples comparisons across state lines. Some of this might be just spurring states into action and having the action imperative that we demonstrated here in Idaho to try things to get your numerator up and your denominator down. Some of it might be policy. There are some policies states may have adopted that have reduced their numerator. How you talk to families of faith, for example, might influence whether or not they're willing to sign up to foster in a state. How you structure adoption policies and reunification policies might influence how long kids are in care and therefore increase your denominator. So we're going to be looking at how we incentivize and disincentivize the right policy so that states get their ratios of homes to kids up.
Are there concerns within the child welfare system about growing the bureaucracy and the industry around it, while also increasing the number of kids that need help? And again, there's not a loaded or leading question. I know that there is that concern. Obviously, like, who's going to say don't fund things around, children that need help? Nobody's going to say that. And because of that, I always get worried. It's like everybody will defend spending for this. And because of that, I can see people saying like, hey man, this is something that will always be funded, and we could build an industry around this like we see with the homeless industrial complex in other states. Is there that concern with this particular thing where you're like, hey, you have policies or you have practices that are actually increasing the number of at-risk youth, and that therefore increasing the funds coming to your state and therefore increasing the number of administrators and things of that nature? Are you concerned about that at all?
I'll tell you why I'm not. The number of foster youth has been on a steady decline. I mean, most states have looked at various prevention efforts, and thinking around child welfare has changed. So, I mean, there has been a steady decline in most states of the number of foster children. What's different for those coming in is because the number of foster homes has also declined. I think we dropped below 200,000 foster homes nationally for the first time in years. is when they do come in, we don't have great placements for them. So we've had to rely on non-traditional settings. We've had to rely on congregate care, particularly out-of-state settings. It's almost impossible to reunify a kid from an out-of-state congregate care facility with bio parents hundreds of miles away. Zoom is not an effective way to reunify. So I guess, a couple trends. Foster kids is on the decline. If you look at federal funding for child welfare over the past couple decades, when adjusted for inflation, it's been relatively flat. And then also, the feds are actually the minority shareholder. It varies by state. But if you look at the national data, states cover about 57% of the total bill. The federal government covers about 43%. So states are carrying the majority of this freight, therefore reducing some of the incentives that you talked about.
Because they're already financially incentivized to improve efficacy and efficiency and all of that.
Conceptually, I think one of the challenges that I've seen is we've built this regulatory thicket around states where we've sometimes taken the eye off the ball. So a lot of what I've done in my first month and a half at the federal agency is try to do some benchmarking. So I said, I've got about 60 programs and a $70 billion budget. So I inventoried how much sub-regulatory guidance do I have for those documents. These are things like Dear Colleagues letters or information memorandums that don't have the force and effect in law, but the agency often squints and creates the perception that they have the force and effect of law.
Please excuse me for interrupting and my ignorance. What is a Dear Colleague letter? Like, what are you talking about?
It's a letter from the Assistant Secretary to all 50 states espousing on a certain issue, saying, here's how I view these issues, and trying to nudge states into taking
Please
search.
Start, if somebody, Dear Colleague, we have found that, if you fast track people that were, certified and registered foster parents in other states that moved to your states, it is beneficial and it's great. So please do that. So it's essentially just hey, we really like this. You have no obligation to listen to me at all, but we really like this. And that has been portrayed as an effective mechanism to persuade different policies or get states on board with what you think.
Well said.
Okay, got it.
Oftentimes it comes with the perception that it's legally enforceable. But across my programs, I found I have currently active 43,000 pages of sub-regulatory guidance. So, and then we also have something federally called the Paperwork Reduction Act. If we're going to require states to provide us information as part of our annual reports or as part of a data call, I have to quantify both the hours burden as well as the cost burden of providing that information. Collectively, I impose a $1.1 billion cost on my grantees in providing us information. Like I said, in one case, 200 data points, none of which was foster homes. I think what you're going to see from me is I want to start hacking through that rainforest. I don't need 43,000 pages of sub-regulatory guidance. I don't need 1.1 billion hours of reports. I need states to focus on action. And in this case, I need states focused on children. Too much of this. We've got this whole alphabet soup of how we oversee child welfare systems. I've got a CFSR, a CFSP, an APSR. As a state agency director who oversaw a child welfare system, I took my direction primarily from my state governor, from my state legislature, my state court, my state media, and the lawsuits that we were under. Every 5 years, having a federal agency show up and say, here are 14 other things that you should be looking at. I said I treated that as Marshawn Lynch at the Super Bowl. I would say, I'm just here so I don't get fined.
I went to school with Lynch. Yeah, I met him. He was dating one of my wife's friends for a bit of time. Beast mode, like that guy.
Well, so let me say, I'm going to go beast mode on our sub-regulatory guidance and our Paperwork Reduction Act burden. I want states putting their top talent, their top people, their energy, and their momentum behind improving child welfare outcomes, not filling out narrative-driven reviews. Just as one curiosity, these annual reports that I mentioned, I might get these numbers slightly wrong, but I'll be in the ballpark. I asked one of the guys on my team to collect all 50 annual reports that states submitted to us. And I think they averaged about 250 pages, annual reports on their child welfare systems. Again, 250 pages. Nobody read that, not even the states that submitted that. How do I know that? Is because we then looked at comparability. Something like 97% of the content year over year was comparable to the last. So you have someone who produced a report probably in the early 2000s, and they've Control-F'd and updated the date each time since. Accountability for federal dollars is key. If we're sending out $12 billion, absolutely, we need to ensure it is going to a high use, that we are deriving value for the taxpayers' return, that they get a return on investment. But I don't think objectively you would say that a lot of what we're doing today is anything more than busy work. So I said, we're going to clear that away, and we're going to allow states to spend more of their time and energy on getting child welfare outcomes. And we're going to look specifically at the ratio of homes per children in each state to give states two focuses. Get your number of homes up, get your number of kids down, use local context, local nuance, local priorities to decide where you focus on both sides of that equation.
Man, that seems to be something that is dearly needed, not just obviously in your area, but like if you look at the education area, like if you had somebody like you going into, education systems and reducing reporting, reducing costs, reducing, administration, are you, and again, thank you for your time so far. Like I know it's Thanksgiving break. One more question. As we move into whatever happens next economically, there is a concern that obviously as the economy fluctuates both up and down, that does have an outcome, both positive and negative, with foster care and child service needs. Do you think that there's anything that can be done in the event that we experience, and we will eventually experience, a recession and worse economic outcomes at some point? Do you think that there's anything that can be done to minimize that damage within the child welfare setting?
Well, I'm a big believer in digging your well before you're thirsty. I think if we commit to a home for every child and the principles of it, and having a robust network of foster homes and effective prevention, specifically mental health support, specifically substance use disorder prevention and treatment services, that we can build this infrastructure to prepare for whatever might be in front of us. And I'm confident in our ability to lay this track work.
Man, that's great. Alex, thank you so much for making the time today. Again, every time I talk to you, I leave, I'm like, wow, man, there are people doing things and they're working and it's great and like, it's going to be awesome. So thank you for what you're doing. And thank you for taking the time to come and explain it to me. Because again, this is talking about things on the national level. Like, I'm not even going to say I've started wrapping my head around Idaho. Like I haven't, there's too much. But again, as I start touching some of the more national things, it's wonderful to hear. It's like, oh, there are people that are hammering, that are oriented properly, that have, success and, outcome-based outlooks, especially with things in the realm of child welfare. So thank you for what you're doing. Thank you for your time today. And let's do it again when I'm in DC.
Appreciate it. We'll see you soon.